Welcome to Duke Spine Institute's live stream of our spine surgery. It is August 3rd, 2023, Duke Spine Institute. Our patient comes here with a history of many back surgeries done elsewhere. He was told by his surgeons that it's normal to have a laminectomy every 5 years. So he's been getting laminectomies every 5 years. And well, we're not going to be doing a laminectomy. We're going to be doing the Duke laser disc repair. If you look at his MRI there, you can actually see that he has a pretty big herniated disc at L3-4. And that herniated disc is pinching his nerves on the left side. Really bad. As a matter of fact, that's his main complaint, is the nerve pain from a pinched nerve. I'm going to come a little bit lower. I'm giving him some numbing medicine shot. Now you can see L3-4. Jordan has done a very nice job of lining it up on the x-ray. Jordan, why don't you count for us? Henry, can you see Jordan's counting? There's sacrum, 5, 4, 3. Where's our target? Right there. That's correct. So we're going to go in, shot. And with a little luck, oh, there's the facet. Perfect. Go under. Gonna get right into that herniation. I feel the herniation. Wow, that thing's huge. It's right here against my needle tip. That is the herniation right there. Yeah, it's huge. I'm not literally bouncing on it right now. You guys see the needle bouncing? That's crazy. How's he doing? All right. Through the herniation and shot. Trying to get into the disc. Man, that's incredible. Whew. No? Yeah, it's fine. Is he awake?
How you doing, my friend? You doing okay? Yeah? We're going to ask you some questions, all right?
Yeah. You're doing great. Just relax. So he's had 4 laminectomies, right? All right, 4. Every 5 years. So his doctor, his prior surgeon told him it's normal to keep coming back having surgery. And you can see the scar right here. It's literally from there to there. I could see it underneath the yellow sheet. That's minimally invasive, right? That's what they told him. He was having minimally invasive. That's, how big is that? Yeah. It's 60 millimeters or 6 centimeters. Ours will be 7 millimeters. Literally 1/10 of that. All right. Now, I like to do a discogram because, well, it tells us if that disc is causing the patient's back pain. And he's not really here for back pain. He's more here for his leg because he's got a blown out disc above his laminectomy. Is he awake?
How are you doing, my friend? You okay? You okay? Don't move.
Does he have any back pain?
Do you have any pain right now? Say yes or no. Yes. You said yes. All right. Okay, stay still for me.
You see that? He arched up. How bad is that on a scale of 1 to 10?
Give me a number. He said a 10.
All right. Is that where you get your pain? Is that where you get your back pain?
Is that where you normally get your pain? Yes.
All right, yes. So he's a 10 out of 10 concordant at L3-4. Jordan, stay there. Guys, look at the size of the herniation. Look at that thing. The dye is wrapping around it. It is humongous. And that's why I took a more lateral approach, was so I can get more medial to the herniation. We're not going to get 100% out, but we're going to get probably 60, 70% of it out. That's enough to get rid of his back pain and leg symptom. So he's a 10 out of 10 concordant at 3-4. All right, so next, what was that? Was that you? Sounded like someone stepped on a cat. Let's go ahead and show our audience the how does a herniated disc cause back pain anyway? What's the mechanism? Place the guide wire shot.
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
When the microphone is on, we hear everything you're saying. Shot? All right. So we're now driving this dilator into the L3-4 disc. So I just shoved the herniation back in. And now I'm going to go take the herniation out from inside the disc. Much safer that way. Any questions from our audience so far?
No currently questions.
Luis is very trusting today. All right, looks like we're inside the disc right there. One more tap for good measure. Let's get the fluoro out. Bam. Look at that, perfection. Perfect endoscopic positioning. Remember, this patient's already had 4, count them, 1, 2, 3, 4, 4. 1, 2, 3, 4. Hana tool set net. 4 hernia each. Knee. So. Ro. Nice. 4 laminectomies. 4 separate spine surgeries. Okay? Huh? Yes, count in Dutch. 1, 2, 3, 4. So, it sounds. The fear especially. So folks, here's the problem. Yeah. Why would you ever want to have 4 surgeries for the same problem? Now, here's the thing. And he's going to watch the video. And he's going to listen to me. He's going to hear what I'm saying. And I want him to. I want everybody to. There's no reason a surgeon shouldn't fix your problem with 1 surgery. Okay, unless you, of course, they don't know about your problem, which happens sometimes. Trying to grab the herniation. You guys see it right there? It's literally just kind of falling apart.
Should be like an appendectomy. That takes 1 surgery.
Here it comes. Oh, mama. Broke. Just broke. So this is the big part of the herniation. Oh, God. It just doesn't want to come out. Maybe I got part of it? No. Broke again. It's so big. Yeah. It's so, no, well, maybe we need Grabzilla. Oh, here comes some more. It's coming out in pieces. I'm getting like 5%, 10% pieces. Ah, hell. Ten of these and we'll get it out. I just cannot get it. I'm trying to, oh, this might be a good piece. No, keeps breaking. Oh, there's a good piece. Let's show the audience that piece. Light on. This is not the whole thing by any means, but that's a good size. You guys see that? Now this, remember, this is just the herniation, and this thing was stuck in the annular tear. Yeah. You guys see it there? Henry?
Yes,
I
we do.
can't hear you.
Yes, we do. Sorry.
Yeah. All right. There's more to it than that. We're going to get a few more pieces out, but that's like probably 25% of it right there. If I had to guess, there's still more. I may need Grabzilla.
Can you grab Brasida, please?
I think Bernadette just wants to see Grabzilla.
Or Jordan, bring Brasida, please. Thank you.
Well, oh yeah, there's another good sized chunk.
Nice one, please.
There's 50%. Right there, you guys see that? Henry? Henry, we
Yes,
need
we do.
answers.
Yes, we do. I'm trying to
Right
teach
here.
Sanjay the mic. I'm sorry.
Yeah, well, you're going to have to still stay with us. So there, 2 pieces so far. It's great to teach, but that would be like me saying, I got to stop operating to teach. No, don't get Grabzilla yet. Just,
I apologize.
oh, there it is.
We see that. Yes, we do.
Oh, you can see that from space. Look at that thing. Yeah. Oh, that's a nice one. And when you add it to its brothers and sisters, you got the whole family of ugliness right there. That is a big, you know, it's nice when they come out easy. But let's keep going, because I think there's going to be some, oh yeah, some annular tear. And Jesus, are you kidding me? Cousin It's coming? Anyway, do we have any questions from the audience?
No current questions. We do have a comment from Kit on YouTube, and they commented in the last video. I forgot to tell the the doctor was from San Diego, and they still have back pain as the same as before the surgery.
Oh, okay, yeah. Oh, no, that was so there's no more herniation I can feel. So I'm going back to the laser. We're going to start cleaning the tear. Yeah, you don't have to mention their name. It's fine. I almost ended up in San Diego when I was done with my training, and I'm so thankful I didn't, because I wouldn't be here today fixing people's backs. The crazy thing about the history, and this is why I believe there's divine intervention, God's will, is that I was a big fusion guy doing fusion surgeries. And there was a particular skill I had. They didn't have anything to do with the spine. It had to do with a disease called trigeminal neuralgia, or other people know it as tic de l'eau. And it just so happened that I went to train with Dr. Albert Roden, the world famous trigeminal neuralgia surgeon. And that was like what he was famous for, is treating tic de l'eau. Not many neurosurgeons have that reputation. Like literally, you talk to 90% of neurosurgeons, they have no idea how to treat trigeminal neuralgia. They just don't. It's a pain condition. No, ENTs don't. No, it's a neurosurgery procedure. So I was doing trigeminal neuralgia procedures, and to do it, I was doing percutaneous rhizotomy of the Gisserian ganglion. To do that, you have to literally use an x-ray machine and find a hole at the bottom of the skull where the bottom of the brain is. And you got to stick a needle up there through that tiny little hole. And then you got to make sure it's in the right spot, and you got to burn the Gisserian ganglion. You're not going to learn this anywhere in neurosurgery, except UF, because Dr. Roten is like a pioneer in doing it. Basically, percutaneous pain procedure. Think about it, right? That's what he was famous for. And I wanted to treat pain. How funny that Dr. Roten and I got together. Anyway, no other residents went on to do this stuff. But I did, and I was doing a couple of cases at Parrish Medical Center in Gainesville. And to do the cases, I needed a special electrode. But Parrish didn't have it. So they found a guy named Galena. Still remember his name. And he's a rep. And he's like all of the reps, you know, he's a hustler for money. He's a sales guy. So it turns out we're doing this like third trigeminal neuralgia case at the hospital, sticking a needle in someone's brain and burning their nerve, dorsal root ganglion, basically. And he says to me, "What do you do with the rest of your time if you're only doing a few of these?" And I said, "Oh, I do spine surgery." And he says, "Oh, would you ever want to learn how to do endoscopic spine surgery?" And I said, "Not really. It's kind of, you know, bullshit. Because if it was any good, I would have learned it in my neurosurgery training, because I went to the best training program." That was my attitude. And he's like, "You sure?" And I said, "Yeah, I'll let you know if I change my mind." So I happened to go home that night. I was talking to my wife, and I was telling her about the case. And I said, "Oh yeah, by the way, this guy said to me, 'Would you like to go learn endoscopic?'" And she said, "What did you say?" And I said, "No, not interested." I'm not interested at all. Like I do fusions. Like that's the real shit, right? So my wife says to me, "Well, you should go learn anyway. It's not like you're not that busy." You know, it was right when I was starting, literally within the first year of my coming out, 2004. It's probably the end of 2004. And she was right. I wasn't that busy, and why not, right? So next time I called him up, I said, "All right, how do I learn endoscopic spine surgery?" And at the time, the only reason he offered that to me was because he was selling this disposable endoscopic device called Claris. Claris. C-L-A-R-I-S. It's like literally a disposable endoscope. You throw it in the garbage when you're done. It's garbage. So he took me to a surgeon who was doing the Claris, and down in like Fort Lauderdale or something. And the guy was a total dirtbag, but I won't mention his name. I heard this guy does a lot of work for attorneys, auto accident attorneys, you know, milking the system. And I won't mention his name. Anyway, he was kind enough to take me in and let me watch a surgery. So, of course, I watched it, and the first thing I thought was, holy God, what is happening here? I've never seen anyone go from the side to get to the spine. That's just never been done. This is in 2004. You know, he's an orthopedic. So the first thing I did was I had to put my eyeballs back in my skull because they were popping out, watching him stick this needle and then a tube, not the wolf tube, but the Claris tube, into the patient's flank. And I'm thinking, like, my head is getting light thinking about, you know, how is this patient going to die? They're probably going to perforate their intestine, or are they going to get the kidney? Maybe the aorta, maybe a vein, maybe the liver. I'm thinking, like, I got all these thoughts going through my head, like, all right, what ICU diagnosis will this patient have when we're done? No, we're in a surgery center. This guy was just doing auto accident patients for lawyers down in Miami. You know, it's just one of those dirtbags you hear about, right? That milk the insurance companies for money, you know, charge $100,000 for a mild surgery, right? Like an injection. So I'm watching and I'm just spinning, you know. First thing I thought was, number one, holy God, is this really happening? Like, pinch me. Am I dreaming? Number two was panic mode, like, oh my God, do I need to resuscitate this patient? He's going to be bleeding internally any second now. There's going to have vitals dropping, right? You know, I'm thinking like, okay, you know, epinephrine, dopamine, drip. How are we going to save this? I can't stand by and watch this guy die. Then when the patient didn't desat or destabilize, I'm thinking to myself, how is this possible, right? Like, this is insane, going from the side. Then I started thinking, how do I get out of here? Like, how do I get the fuck out of this place and not have my name anywhere near the patient's record, because there's going to be a lawsuit. It was really an amazing day, I got to be honest. It changed my whole life. Of course, the patients didn't have any complications, and they actually felt better. And I'm like, really? Come on. But they really did feel better.
So he was putting a laser through that.
Yeah, he was doing like a little percutaneous laser thing.
Through the disposable tube?
Through a tiny little sheath, yeah. Yeah. Yeah, that's right. Huh? Yeah. All I know is the unit was $5,000 disposable. All right. I don't even know if they make that anymore. And so I was just honestly, Claris. I was honestly just freaking out. I was just fearful that patient was going to die. And then when they didn't, we did a second one. They did fine. And then I started to think, what have I been missing? Is this possible? I literally am top G trained in spine surgery in the United States, and I didn't know anything about this. I thought, holy crap, you know, let me learn more. That's when I was introduced to Dr. Young, Anthony Young. And then Dr. Young introduced me to the whole group of endoscopic spine surgeons at the time, the top in the world over in Korea and Germany, Dr. Sebastian Reuten, and Dr. Seng-Ho Lee and Gun Choi. And I met them overseas and I trained with them. They're Koreans. And I didn't train very long with them, only a few days. Then I came back here and I started to do these procedures. And I held my breath. And lo and behold, I somehow managed to get it right. And of course, built on that over the years. So here we are. Getting, in the immortal words of is he doing all right? All right. Yeah, I'm almost probably another 3 minutes. In the immortal words of Negan, for those of you who know who Negan is, getting shit done. Right, Luis? All right, any questions from our audience?
No current questions. We do have a couple comments. This first one comes from the Anna Burke on YouTube.
Sure.
And they said, hello to all. This is awesome. I'm in San Diego and we'll go to your clinic. Fascinating class as usual. Godsend indeed.
Oh, thank you so much. Yeah, I apologize for the poor visibility. Normally you can see much better, but the reality is that once you remove those big pieces of herniation, then the veins that were just behind them feeding all the inflammation, well, they usually open up and they start to bleed. And that's what we're seeing, a little bit of that. So here's a little scar tissue. We're literally at the back of the disc right now. And I'll show you the anatomy in a second, but right now I'm working on trying to get more of the herniation out. Remember, don't ever expect to get 100%. You're not going to. So don't even try. If you try to get 100%, you're going to hurt the patient every time. No surgeon in the world can get 100% of the herniation. Okay? What we want to do is get enough of it that we get rid of their symptoms permanently.
You don't want to gild the lily.
You don't gild the lily. So this is herniation right here. It's stuck on the back of the nerves. And I'm trying to see what I can remove safely. There's the epidural space. Again, I'm coming in very lateral. My trajectory is very, very lateral. And I'm quite literally at the back of the herniation right now. Okay? You can see scar tissue there that I'm peeling off with the laser. And the herniations make these scar tissue happen. I got 2 minutes probably, unless something happens here. It's really not much. Any other questions or comments?
Yes, next comment comes from Muhammad on YouTube.
Well, Mohammed, welcome back.
They said, "Hello, doctor. Hope you are doing fine with all your colleagues and family."
Oh, thank you, Mohammed. Everyone's doing well. Thank you. I hope you're well as well. There's a piece of herniation. Good size, not a giant. Yes, Mohammed. Blessings to you and hope you're well. Oh yeah, there's another herniation right there. Oh sure, yeah. Oh yeah, there it is. There's a big piece. Oh, it's beautiful right there. That's beautiful. That was literally shoving on the nerves. Can you see this, guys? Lights on?
Yes, we can.
Right there. So that's, you can see how it looks just like the other ones. It's a little smaller. But these are all, we're just about a minute left. These are all herniations collectively, okay? Remember what I taught you. Herniations are not a one-time event. It's not like one piece of herniation. Usually it's several pieces. And you can see how many pieces. And each one of these pieces usually represents another time that the patient had a herniation.
We have another comment from on YouTube.
Uh-huh.
This comes from Alice, and they said, "God blessed me by accident, moved to Tampa, and found you. I had a laminectomy, then a spinal fusion with bone transplant, left hip, hospital for joint disease, left with RSD, and now multiple herniations."
I'm so sorry. So sorry to hear that. Yeah, I would caution everyone, folks, you must look after each other. You must look after yourselves. The doctors that take care of patients with spine problems are unfortunately horribly misguided for the most part and misled, and they are not putting your best interest first. And so what's happening is patients are getting a lot of unnecessary invasive surgeries that are dangerous and harmful and have long-term complications. All right, we're just about done. I keep thinking I'm done, and then I keep finding another piece of herniation. So Dr. Berndes, I really am almost done. But We're literally taking this out so many pieces. This is a big herniation. I've had taken out at least 20 separate pieces. And every time I take one out, there's another one waiting. You see that? But I'm very close to being finished. Now folks, go ahead and type up your questions. I'll be happy to answer them for you. And we need to talk to Richard and find out if we're doing one more today or not. Oh.
Gina just texted me, said we will know in 20 minutes.
All right, the biggest, a huge piece. There it is. Lights on. Oh my Lord. This guy really, when you blow your disc out, you can blow it out, in style. Look at that thing. That was up against his nerve. That's it, guys. Look at this. Today was a bounty of herniation. One disc. One disc. Most surgeons love to brag about taking out a piece of herniation this big. But my God, Louise, we hit the jackpot. You guys see all that? That's a great one for posterity there. Why don't you put this one, Henry, for the testimonial?
Copy that.
So that would be a good segment. Scope on. I think we're just about done. I can't imagine there's more in here. Let's see. I mean,
So getting a laminectomy for that is like eating new sneakers and coming home with a pair of gloves.
yeah. Yeah, you don't want to get a laminectomy. I think we're done.
All right, that's on, please. Thank you.
I don't feel any more fragments in anywhere. Great job. Folks, we did all of this with this little tube. Let's put the tube next to it. Let's show everybody in just a moment. Great job, team. We fixed one disc. Remember, he's had so many surgeries already down at 4551. His spine looks like a mess. But today we fixed 3-4, and I think he's going to be happy. It was causing back pain. It was causing leg pain, weakness in his leg, numbness in the leg. All that will go away now that we fixed the problem. And we did it without open surgery. So remember what I showed you earlier. Remember the incision on his back from his laminectomy? Right? I'll show it to you again.
He did very well. Great blood pressure.
So the laminectomy incision was from here to here. You guys see that?
Yes,
That's
we do.
60 millimeters, 60. We just did one with 6 millimeters. You guys see that?
Yes, we do.
And through this little tube, we took all of this herniation out. Through this little tube. Luis, that was a good one, huh?
Oh, yeah.
Good job. Well, thanks for joining us. We're going to show you a little testimonial, and then I'll come answer questions while Luis finishes up in here with our team. Great job, everyone.
I need these boxing 4x4, please. Thank you.
You good? I'm Dr. Ari Duke-Majan at the Duke Spine Institute, here with a patient from Virginia who came out to the Duke Spine Institute yesterday for surgery, and we fixed 2 discs in his lower back. You were having back pain for some time. Do you still have that same back pain?
No.
Gone.
I feel, my back feels 100% this morning. I was able to sleep in the bed, laying flat for the first time in 2 months. I was sleeping on the couch for those 2 months, and I did not get good sleep at all. So I feel great in my back.
Good. Well, that's why we're here. We wanted to cure your back pain and give you quality of life back. What was life like living with that back pain?
Any day you'd be like, it could happen today. I could go down with back pain, severe back pain for a week. And that happened. My first pain started about 5 years ago. I was working in the flower garden I went down with severe pain. I was down for probably a month that time. And ever since then, it was just like randomly, just out of the blue, I'd go down for another week with severe back pain. It was just no way to live because I knew every day waking up it could happen today.
Yeah, it is no way to live because then you got to be careful every day. You don't set it off. You're worried about it. You're thinking about it. It takes control of your whole life, that back pain. His back pain happened to be coming from 2 discs. And did you see any other doctors? Did they recommend treatment for you in Virginia?
Yes, I was seeing chiropractors for the first number of years. The first chiropractor, he put me on this decompression table, and he would, pull you apart. I did that for 6 weeks. I felt a little relief at first, but it didn't last very long. And I've been seeing just regular chiropractors throughout the years as well. And then when this happened, I saw an ortho doctor. He did not recommend surgery. He recommended physical therapy. He said surgery it's like a coin toss. It either works or it doesn't. And that was not good enough for me. I needed a little bit more reassurance that it's going to work. That's when I started looking for other options. And I had a lot of time on my hands. I did a lot of research and I found Dr. Duke here. And I started watching his videos and testimonials, made up my mind right there. It was without a doubt, that was my choice right there. I submitted my MRIs and within 2 days I did my virtual consultation with you. And 10 days later I'm here. And it's amazing. I had an appointment with an orthopedic doctor in Charlottesville, and that was February the 2nd for my first visit, just for a consultation. And who knows how long it would have gone after that.
Years.
Yes, I'm done now. It's just, I'm back to recovery.
Yeah, the problem is, unfortunately, the vast majority of doctors treating back pain don't know how to cure it. They just don't. And if I had to put a number on it, I'd say 99% do not know how to cure back pain. It really comes down to 2 things. You have to make the right diagnosis. Where is the pain coming from? Most doctors really don't even know it comes from the disc, and that's where it comes from about 90% of the time. Then the second problem is knowing how to treat it. And the treatment that works, the only treatment that works, is surgery on the herniation, really. And there's 2 surgeries that work, fusion and the Duke laser disc repair. I've done fusions for years. I've cured people's back pain with spinal fusions, but that's a big, bloody, messy surgery with screws, rods, cages, long recovery. You're on opioid painkillers for months, like 3-6 months, just taking painkillers, just getting over the pain from the surgery. Not the back pain from the surgery. So when we started doing the laser surgery, people weren't having any back pain afterwards. They'd have just a little discomfort for one night. We realized they didn't even need the opioids anymore. So our laser patients don't get any painkillers except Tylenol and usually 1 or 2 Robaxin. So you did it. You happy you did it?
I'm very happy.
Yeah. And you can see in the surgery that we did, we actually got into your disc. We used the laser to clean up those tears at L4-5 and L5-S1. Surgery went really well for you. We didn't have any problems. It was just a tiny Band-Aid incision on your back, and that's why you went home an hour later, and that's why you're here today, ready to go home. Where are you guys heading back to Virginia?
This afternoon.
Driving?
No,
Flying?
we're flying.
Flying out of Orlando?
Orlando.
Awesome. Anything you want to say to your friends and family and people you know out there?
Yes, living in pain is hard. It's not a way to live. And I recommend Dr. Duke any day.
Well, thank you. I appreciate that. You had faith, and you're going to be rewarded for that. Congratulations.
Thank you.
All right. Good to see you. What an exciting case, and what a great testimonial from this patient. So you watched us treat L3-4. This patient had a giant herniation of the disc, behind the disc, against the nerve, pinching the nerve horribly. And I went in from the side, and we were able to find the huge herniation and remove it. And it went very well. You could see in the video, if you go back, there's several pieces of large herniation and a whole bunch of small pieces. It's amazing to fit those giant things out of the tube, isn't it? They're like caterpillars coming out. But the surgery went very well. We didn't have any complications. We lost just about 20 drops of blood, which is nothing. If he had had open back surgery, he would have lost 500 cc's. We lost 1 cc. And then, of course, he'd be laid up in the hospital for days, and that's only if he didn't have complications. With complications, you're there much longer. This patient's going to go home in 1 hour. It's an outpatient surgery we do. It's done with a 7mm incision. And his surgery went fantastic, so I'm excited for him. All right, what questions do we have?
This one, so far we have 2. This first one comes from Smedley Butler on YouTube.
Smedley Butler on YouTube.
And they said, "You are the man, Dr. Duke. Have you ever removed bone spurs by going through the simplified artificial disc? I regret having installed."
I see. Yeah, so my friend, listen very carefully to me, Smedley Butler. Reminds me of a movie with Chevy Chase. What was it called?
Caddyshack?
Not Caddyshack. The one where he's in prison or in jail.
Oh, I haven't seen that.
Bend over.
Bend over, something like that. Yeah.
Oh, he's bent over.
I get it.
Oh, it's right there on the tip of my brain.
I'm looking it up.
Come on, you don't know this one, with Chevy Chase? Fletch. Wasn't it Fletch?
Yeah.
Yeah,
I
Fletch.
believe so.
Anyway, so to answer your question, I am almost, I would say 90% sure that you do not need to have those bone spurs removed. I think we can fix your problem safely, but not even remove the bone spurs, because I really would be surprised if the bone spurs are the cause of your problem. That could be wrong. That said, the best thing for you to do is to do our MRI review and let me take a look. Now, I will tell you this, you're going to need a CAT scan so I can see the bone spurs. You're going to need an MRI, and you're going to need that Zoom call. All right? So, I'd be happy to try to help you out, but I think if you're having symptoms like neck pain, headaches, etc., then we can fix it without going through your disc and without messing with the artificial disc. I could be wrong, but I would say I'm very, very optimistic. Okay? Next question.
Next question. First, the Annenberg said Fletch as well.
Yes,
So,
it was. Thank you.
No worries. Next one comes from Mohammed on YouTube.
Hello, Mohammed.
And they said, "Hi, doctor, again. I want to know, are you removing the annulus or nucleus of the herniated disc?"
Yeah, so great question. Huh? Well, it is, and it is the annulus too. All right, so you see this disc right here?
Yes, we do.
We're looking at it kind of top down. The disc has 2 parts. It's got a wall around it. And if you've ever had steak, sorry Sanjay, but it's got this very thick connective tissue around the meat. And we call it the rind, right? But it's really like a tendon, okay? And so that's what this is around the disc. And then it's got a different stuff in the middle. It's kind of like a jelly. So when you have a herniation, you have a tear in the rind, and the jelly pushes into the tear and bulges out. And that's what we are dealing with today. So I went in and I used the laser to zap away the nucleus herniation that was here in the middle. Now it's up here. So I'm not removing the disc, I'm removing the herniation. And I'm cleaning the scar tissue out of the tear. So I'm not removing the annulus, I'm not removing the nucleus, I'm removing the herniation, and I'm debriding the tear. That's really what the surgery is about. We don't get into the normal part of your disc. We leave it alone. We don't want to take your normal disc out. We don't want to take the annulus out. We just want to clean up the tear that can't heal, and it's causing pain.
And that is it for questions. We just have one more comment, and this comes from the Annenberg on YouTube. When you pulled out that last herniation, they went, "I put that last chunk on a necklace. You guys are awesome."
Yeah, you know, it's not a bad idea. I could have it casted in wax and then have like this golden, right,
Oh,
chunk
my
of herniation.
I said you had enough there, you could almost write Duke's spine with it.
Right? Yeah, you're right.
Yeah.
We could have built something with that.
Yeah.
Unfortunately, people ask me, can you put it back in the disc? The answer is no. It's damaged, it's destroyed, it's broken off. You cannot put it back. You put it back, what will happen is with the patient moving around, bending, twisting, they're going to push it back out through the hole. So it's a loose body. I mean, orthopedic surgeons talk about loose bodies all the time. This is kind of a loose body within the disc, and it's not safe to leave it there. You got to clean it out, get rid of it. Otherwise, it'll push on the nerve even more. So thanks, everybody. I think we have maybe, I don't know that we have any more today.
I think that's it.
Our last patient from Africa does not want to broadcast, so if he does end up getting it done, which we're kind of on a hold pattern right now, then we will not be broadcasting. So we may be doing him tomorrow, but we still won't broadcast it. So I guess we'll see you all on Tuesday. We have a very, very, very full week next week. We've got, I think, 5 cases on Tuesday and maybe 4 or 5 on Thursday. So we are busy. All right. Come back and join us next week. Have a wonderful weekend.